Hello, my name is Rachel Callaghan, and this is my CVAD dressing video. So first thing I would do is I would check the doctor's orders to verify that he actually ordered the procedure, and then I would verify the dressing and flush protocol of the facility that I worked at. I've already gathered up all of my equipment, and I'm going to go see my patient. Hand hygiene. Hello. Providing privacy. My name is Rachel. I'm a nursing student with St. Martin's University. I'm here to do a dressing change on your access. Is that okay? All right. Can I get your full name and date of birth, please? Thank you very much. Okay, so I'm going to be setting up while I'm explaining what's going to happen, okay? So I'm going to be raising up the bed, and I'm going to be lowering the rails. So I'm going to be removing the outer portion of the dressing, and I'm going to be putting on gloves. After I've removed the outer portion of the dressing, I'm going to be cleaning underneath with sterile, with chlorhexidine, and then I'll be replacing the circular disc that reduces infection. And then I'll be placing a new dressing on it and giving it a flush, making sure everything's good. Does that sound all right? Okay, I'm gonna fix your mask a little bit, and then during this procedure, would you mind looking that direction? That way you're not breathing on it as I do this. All right, perfect, thank you. Okay, so now that I've done all of that, I'm gonna begin removing the outer dressing. And I'm going to be doing that by making sure that I do not disturb the actual catheter too much, as little as possible. Okay, and then also removing the disc underneath. Okay. There's all of that. Okay, now at this point, I'm going to be visualizing to make sure that there is no signs and symptoms of infection or infiltration. And everything looks good. Is there any tenderness to the site? Okay, that's good. Thank you. All right, hand hygiene. I've already sterilized the surface prior to coming in. I'm gonna create my sterile field. And I'm gonna don my sterile gloves. So we put on sterile gloves to make sure that everything stays as clean as possible. Alright, and I already have a mask on, so I'm going to just discard the mask. I'm also going to discard that. Okay, now I'm going to so if there was any major debris like blood or anything like that, I would clean that off first with an alcohol prep pad, then breaking the chlorhexidine. I'm going to vigorously rub in a 3-inch diameter, making sure that I sterilize everything as much as possible. This is going to be my dirty hand from now on, and we're going to sterilize all sides of the tubing, 3 inches up in all directions, being careful not to pull it out or disturb it too much. Now at this point, I'm going to allow it to dry, so that could take a minute. And then also that. Go over here. If I had any additional stuff on there, I'd pull it off with that. All right. Now that everything is relatively dry, I'm going to place this underneath. Okay. Now that that's on, I'm going to come in with my dressing. Making sure that everything is in line. Okay, I'm going to place this down. Pinching the side a little bit. Okay. All right. Now, obviously nothing is sterile anymore. So I'm going to remove this dressing. And I also understand that this is the wrong tachoderm. It was what I was given. So I'm going to take this off, making sure that everything stays intact as much as possible. I'm also going to label with date, time, and initials that everything was performed. I'm going to label the top of that. And then right before, just gonna put this right there for a second. Okay. Now, because I don't have to maintain a sterile field anymore, I'm going to scrub for 15 seconds, allowing to dry. We're already done that. Gonna connect, disconnect. Also, and then I'm gonna do pulsating, quick pulsating. Also, something that I forgot to mention is that if for any reason an IV line was hooked up to this at the beginning of the procedure, I would remove it. I would put it on pause, clamp, remove, and then after the procedure, I would hook it back up again. All right. So we're done there. I have clamped. I'll remove. And then we're just going to tape it where we want it. Right there. Okay. How are you doing? Hopefully that wasn't too bad. Okay. I've already put date and time. I've already verified everything else. So at this point, I'm going to put the patient back in the position that I found them. Make sure that the call light is close to them. I'm going to discard all of my used equipment. Do you need anything before I leave? How did you feel that went? Are you in any pain currently? Okay, good. I'm glad to hear that. So after I leave here, I would document. I would also hook up the IV if it was running initially. And then after this, I'm going to go and document. I'm going to do date, time, what procedure I performed. I'm going to document whether or not I saw any signs and symptoms of infection or infiltration. I'm going to document that old dressing was removed, what products I used to clean it, what dressing I put on top, and how much I flushed it with, and whether I met any resistance or not, and then whether or not I hooked it up to this, and how the patient tolerated it. And I will clean up, and after that, that's my video. Thank you.